I want to acknowledge two people in the audience. We had at Good Samaritan Hospital, Matt Goldstein and my wife Penny Insel ran the best congestive heart failure program in the city, and I want to just acknowledge that. We have John Hopkins here, we have University of Maryland, and Little Good Samaritan Hospital that Matt and Penny ran was the best congestive heart failure program in the city, and that's the largest. We're making a presentation, a special presentation here to Hatzalah. Matt is the leader of Hatzalah. I apologize, the plaque is not as big, but we'll get a big one for you. And we have certificates to all the volunteers who spent tremendous amount of time. Matt, you got to stand with both of them. I want to thank the office for putting this together, and we really appreciate as the community, the whole community, the Jewish, the non-Jewish community, regardless of your race or religion, Hatzalah is there for you, and that's important. Hatzalah is there for you. And that's a key very much. Thank you very much. Okay. There are two speakers between you and the food, and we know what's important. There are two. You want to listen to myself and Dr. Young. Now, I want to speak for a second about Dr. Young. Dr. Young is my personal doctor. He literally saved my life 20 years ago when I broke my back, and I really have to be Makar Tov for that for all these years. Dr. Young is the best physical medicine and rehabilitation doctor in the city and possibly in the United States. Dr. Young is internationally known doctor. He does a tremendous amount of research, and I would just recommend that everybody look at his book. He has a book called Woman in Pain, but he is truly an excellent physician and a wonderful human being. He gives of his time 24/7 to everyone. And it's really a truly honor to be here and to be able to introduce my friend, Dr. Mark Young.
Thank you very much, Dr. Insel, and most importantly, thanks to all of you for turning out tonight. The topic that I'll be discussing relates to pain, pain in your joints and how to deal with it. What we'll be doing is taking a geographical look at the various joints in the body, and in the interest of time, I've decided to really restrict the discussion to two major joints, because these two major joints are commonly the cause of pain and complaints in patients. That includes the hip and the knee. Now, my first task is to just bring it up on the computer here. Nope, that's not it. That's okay. I don't read Time magazine anyway.
Okay, where's yours? Is that yours?
Yeah, that's it. Taking care of your joints is a major priority. And one of the ways that you're going to be able to take care of your joints is to know some of the reasons, some of the causes for your pain. Uh-huh. Okay. There we go. Technology is great, but you need to know how to use it. At any rate, before I delve into the discussion of hip and knee pain, I think it's important that we offer due acknowledgments to Rabbi David Katz and Dr. Jerald Insel and the many wonderful speakers that preceded me, my family who's here tonight, neighbors, friends, and guests, and most importantly, my patients. Someone named William Arthur Ward, an American scholar and teacher, once said that feeling gratitude and not expressing it is like wrapping a present but not giving it. Actually, it was the Rambam who said that. So we'll be talking about providing you with the definition of it, what a joint is, and then talking about pain, then talking the two most common causes of pain, and then I'll be delving into a more of a discussion and a look at knee pain and hip pain, and then general discussion of why men and women are different. Now, how many people here have pain in their joints? How many people have hip pain? How many people have knee pain? Welcome to the club. We're all as part of an elite club. Well, what is a joint and why do we have pain? A joint is actually the juncture point of two bones. And what is the function of a joint? Well, for one, joints hold bones together. They give stability, but they also give mobility. They allow us to move. They allow us to bend and stoop and twist and turn and squat and do all the important things that we do. But bones also act as an important lever. They're attached to muscles, and the muscles provide the joints with power and enable them to move. And so because of the fact that movement occurs, we frequently develop pain. Any moving body develops pain. Now, it's important to understand what pain is. And in purely academic circles, I spent most of my career in an academic environment. And so I like to refer to the definition of the IASP that says that pain is not only a physical phenomenon, but it's also a sensory and emotional experience. When you have pain, it hurts, and it's depressing, and it really gets the best of you. So it's important to recognize the multiple dimensions of the pain experience. Pain is also very subjective. Pain is in the eye of the beholder. One person's pain may be another person's pleasure. And so we all have different pain tolerances. We all deal with pain very, very differently. And men and women, I'll tell you, differ in their response to pain. We'll be getting into a little bit of a discussion shortly. Let's not veer off too far before we start talking about the two most common forms of pain in walkers and runners. Most of us are walkers, some of us are runners, and all of us experience pain to some extent to another. As we said, the hip and knee are both commonly afflicted joints. Now let's take a closer look at some of the more common reasons for pain in the knee. Arthritis is something that's ubiquitous. It occurs throughout society. There's two types of arthritis. There's degenerative arthritis, there's rheumatoid arthritis. Arguably, there's many forms of arthritis, but those are the two most common. There's also structural causes of pain. Pain that comes about because of our the way we move, the way we bend. It could be injury to ligament, tendon, bone, muscle, even a bursa, which is a fluid-filled sac. And so in the situation of arthritis, one of the challenges that we face as physicians is to differentiate between whether a pain in the knee is because of degenerative reasons or rheumatoid reasons. We have many of my colleagues in the audience that see this on a daily basis, and it's really important to consult your physician about the cause of your pain and get his or her input about it. It's also important to remember that with osteoarthritis or degenerative arthritis, which is the most common form of arthritic involvement of the knee, there's a progressive day-to-day wearing away of the joints. Most commonly, this occurs in folks over the age of 50, although the process begins at a much younger age. Contributing factors may include things like trauma, age, meniscal injury, obesity, bone fractures around the knee, even trauma. Rheumatoid arthritis very often arises because of a natural process that is partially genetic and partially environmental. Frequently presents with pain, swelling, stiffness, decreased range of motion, and even inflammation of joints known as synovitis. And it's not really that difficult to differentiate. Blood work is an important part of looking at etiological or causative reasons for rheumatoid arthritis. And most importantly, we need to remember that pain in the knee can bring about a decrease in function and could slow us down. So it's important to take into account the various causes. And treating pain is a lot like building a house. Why do I say that? Because building a house, the first step is a foundation, putting the foundation in. And the foundation for treating pain is getting the right diagnosis. The blueprint for that foundation are the diagnostic tests, the X-ray, the MRI, possibly musculoskeletal ultrasound, which we'll talk about in a little while. Now, there are other causes of pain in the knee that I don't want to ignore, and I'll just briefly mention them. Patellar tendinitis, Baker's cyst, which is a cyst that occurs in the back of the knee, bursitis, meniscal injury, ligamentous injury, and there's many, many more, which we won't go into. Now, let's talk a little bit about pain, and in the interest of time, I just want to let you know that hip pain can arise for many reasons, and the reason hip pain is known as the great imposter is because very often hip pain may arise from trauma or damage to the back, sometimes nerve injuries, sometimes sciatica can masquerade as hip pain. So it's important that it be systematically evaluated in order to determine a cause. We like to divide causative reasons for hip pain into 3 geographic anatomical areas: anterior, lateral, and posterior, meaning front, side, and back. It's important for us to remember that the hip is a ball and socket joint consisting of a femur and an acetabulum. And a hip is held in place with many ligaments, tendons, and muscles. The hip is surrounded by bursa, which is a fluid-filled sac, which frequently becomes irritated with progressive use. And pain can arise from many reasons, including vascular problems, and including nerve problems, and so on. So it's important to differentiate those causes in a systematic way, and your doctor will be able to assist you with that. This is just a graphical pictorial of some of the muscles in the hip. And let me just briefly remind you of some of the major reasons why people have hip pain. No doubt that osteoarthritis is the most common reason. Inflammatory conditions like rheumatoid disease can cause it, issues with muscles and tendons, sports hernia, obturator nerve injury, and various other more esoteric, less common reasons. Again, DJD is a wear and tear. Degenerative arthritis is largely a disease that occurs over time. It's degenerative in nature. Things that could contribute to it include age, trauma, ligamentous injury. Now, what about women versus men? Is there a difference in prevalence of an incidence? Well, these are some statistics that were quoted in Hoopman's classic article in Arthritis and Rheumatism in 2006. And what you see here is something very interesting, and I've taken a personal interest in the topic of gender and pain and why women are different than men and why women aren't small men when it comes to pain. And the fact is that women seem to suffer disproportionately more than men, and that applies to various causes of pain, not only the degenerative type, but also the bursitic classification. In fact, bursitis is the second most common cause of lateral hip pain, or pain to the side. Pain is usually very chronic, and it's tender, and it's exacerbated or made worse when you go up steps or you go down steps. There is also reason to be concerned about pain that occurs in the back, and pain that occurs in the back of the hip can be directly resulting from degenerative conditions in the low back. Things like spinal stenosis, degenerative disc disease, sacroiliac disorders, and even arterial insufficiency. So there's many reasons for it. Now, not to panic. Your doctor will be able to navigate the various reasons for your pain and point you in the right direction. And by diagnosing and by creating that foundation that we spoke of moments ago, you could actually build the 4 walls. The 4 walls are the 4 walls of treatment. One wall is medication. One wall is physical therapy, possibly acupuncture. Third wall is nutrition. And fourth wall is exercise and stretching and proper body mechanics. And in that fashion, you'll really be able to improve your hip condition or your knee condition quite well. And just a quick word about biomechanics. The old saying that the hip bone's connected to the ankle bone, well, it makes perfect sense, because think about it. We walk. Can anyone guess in 1 minute of walking how many times our foot hits the ground? Anyone have a guess? 80 times per minute our foot hits the ground. And think about it. When our foot hits the ground when we're walking, what's going to happen is that impulse is going to be generated, and it's going to go up the leg, and it's going to affect the hip. It's going to affect the knee. It's going to affect the back. Imagine if you had a headache and someone pounded on your head 80 times a minute. Headache wouldn't go away, would it? So good mechanics, good biomechanics, wearing comfortable shoes, and being able to correct your biomechanics is an important part of proper hip management, hip, knee, and spine management. So clearly foot bone's connected to the hip bone. And I'll just put a quick word in, a positive word for technology. We now have ways of diagnosing soft tissue injuries to joints, including the hip. And this is just an example of a person who had a bursitic condition, and there's an obvious difference in the amount of fluid. Fluid in ultrasound is, any radiologist in the audience? Fluid is represented by dark, non-echogenic field, and you could actually see that there's a greater amount of fluid in that dark area over there. So basically, I want to just spend the next 2 minutes talking about conservative means of dealing with pain. I personally am not a surgeon. There certainly is a very important role for surgery in managing end-stage degenerative conditions of the knee and hip, but we try to avoid that. And any good surgeon will tell you that trying to avoid surgery or putting it off as long as possible is important. There's always going to be a point where surgery may be needed. But in my world, we focus on the role of non-opioid medication, nutrition, exercise, acupuncture, physical therapy, complementary and alternative medicine, and biomechanics. And just a quick good word about acupuncture, because it's been something that I've been doing since 1991 when I joined the faculty at Hopkins. Basically, acupuncture is an ancient Chinese art. There's growing evidence and mounting scientific validation for its effectiveness. Basically, it involves insertion of needles in a variety of different points and meridians. Very often, those points don't even correlate where the pain is. Simply by releasing endorphins into the bloodstream, you're decreasing the pain and you're reducing spasm. It does not work for everyone, so we always try to set expectation level reasonably. Neurophysiologically, it's thought to promote release of endorphins and initiate a cascade of other neurotransmitter effects. The end result in many cases, not all, is pain reduction, even for some people anxiety reduction, and so spasm reduction. And the science is building up. Scientific evidence seems to suggest that serotonin and norepinephrine are both chemicals, neurotransmitters that play an important role. And it could easily modulate these chemicals, and pain is generally thought to be caused by increased central stimulation via pathways that ascend, and it'll interfere with that mechanism. There are many advantages of acupuncture besides